Hi, everyone. Thanks so much for being here today with us to talk about LEED credit strategies for healthy spaces. So I hope this is the session that you meant to come to, and if it's not, you're still welcome to stay anyway. So I am Megan Sparks. If I can advance our slides here. All right, we're in business. So I'm Megan Sparks. I'm Director of Integration Strategy at GBCI, and I'm here with my colleagues Melissa Baker with USGBC and Eric Ring from LPA. And we're going to talk a little bit about health in the built environment and how LEED fits into that. So I want to start off a little bit about what determines our health. And I know there's been a lot of talk in our industry, especially lately, about health in the built environment. And it's not a new topic. People have been studying health in the built environment for many years, doing studies, trying to figure out how to optimize people's health based on the space that they work in, the space that they live in, the space that they play in. But part of the reason that it's become a bigger topic recently is because of advances in technology. We're starting to be able to measure some of the impacts of the built environment on health in more detail. We're starting to be able to learn more and to make new connections that we weren't able to in the past. So health has become even more relevant because we're able to better understand it. So what does determine our health? If you look at the World Health Organization, they've really broken it down into 5 different categories of just what in general impacts human health. So the first that they've identified is the social environment. So really, someone's income and social status. Whether or not you're able to afford health care has a big impact on your own health. All sorts of different social factors can impact your health. We also have the economic environment that also has a big impact on your access to healthcare and what infrastructure is available to you to help yourself improve your own health. We also have the physical environment, which we're all here at Greenbuild. We're all very familiar with the physical environment and how that can start to impact how you feel and your health. We also have an individual's own characteristics. So how someone behaves, how they react to stress. We also have someone's own DNA plays a big role in their health. Some people are more predisposed to certain diseases or conditions. And like I said, a person's behavior, just how you react to stress and how you interact with others in your life. How much you keep active. So some of these items are a little bit more difficult for us to address in the built environment. But what LEED really tries to impact is these key items that are highlighted in green here on the slide. So we're able to make some impact on the social environment. So LEED does try to advance social equality through the built environment. So we're able to touch on that. LEED is also able to influence people's behavior through the built environment. We all know that design strategies can impact how a person behaves, and so through that mechanism, we're able to affect someone's behavior. But the main area that LEED is able to address is the physical environment. So we're going to talk a little bit more about that today. But before I get into that, I want to share a few stats. So according to the World Health Organization, globally, 23% of all deaths and 26% of deaths among children under the age of 5 are due to preventable environmental factors. So these are all environmental factors that we have control over in our physical environment. Some of them are larger than what any one individual can control, such as climate change, but climate change is the result of the impact of all of our individual actions. So we all have control over our own physical environment. I also want to talk a little bit more about some of the more direct impacts that climate change has on us. I know we hear a lot about how climate change can have an impact on the spread of disease throughout the world, making certain diseases, certain illnesses more prevalent. And sometimes it's a little bit hard to make that connection because climate change is, how can the weather impact whether or not, I'm getting Lyme disease, for example. But I want to take a little bit of time to talk about Lyme disease. I don't know if you all know what Lyme disease is because it's a disease that's very prevalent here in the northeast section of the United States. But I grew up in Connecticut, and Lyme disease is very prevalent in Connecticut. As a matter of fact, Lyme disease is named after this town in Connecticut called Old Lyme. So Lyme disease is an illness that is spread through ticks. They're these little bugs that when they bite you, they can spread this disease. And ticks really thrive here in the northeastern United States. So my husband actually also got Lyme disease, and he got it right before we went on vacation to the Caribbean. And so he actually became sick while we were down in the Caribbean. And we pretty much knew it was Lyme disease because he had the telltale rash. You get a very distinct rash where the tick bit you when you get Lyme disease. So we pretty much knew what it was. We were fairly confident. Here in the Northeast, they teach you a lot about Lyme disease to recognize the signs. But down in the Caribbean, we went to a doctor, and they said, no, it's not Lyme disease. We don't even know what that is. So it's so prevalent here in the Northeast that even in other places, a lot of people haven't heard of it. So I want to show you this graph, which is from the CDC, and it's tracking the prevalence of Lyme disease, just the number of reported cases here in the U.S. And you can see that it's grown quite a bit from 1990. And keep in mind that Lyme disease was only named back in 1975. So starting to track this is fairly new, and we don't have a lot of stats that go back further than this. But the prevalence of Lyme disease has really grown quite a bit over the last 20 years. And they've even indicated that this graph probably doesn't represent the extent to which the disease has grown here in the Northeast. It's probably more than doubled in the number of cases that have happened. And one of the theories behind why it has grown so rapidly is because of climate change. Basically, what happens is the warmer temperatures accelerate the life cycle of the ticks, and so their reproduction goes up 2 to 5 times. So it's spread quite a bit. We also have started to see it in twice as many states in the U.S. It used to be localized here in the Northeast, and now we're seeing it very far down south, and we're seeing it to the west because the conditions are such that ticks can start to thrive in more areas. So climate change can certainly affect the spread of diseases such as Lyme disease, and as we know, it can spread all sorts of other diseases as well. For example, any disease that's carried by mosquitoes, the prevalence of additional rainfall creates more pools for them to thrive in, and everything in our ecosystem is connected, and this climate change can have these drastic impacts on our health. So let's talk a little bit more about the physical environment and what we really mean when we talk about the physical environment. What does that include? So it encompasses a pretty wide range. We're talking about exposure to hazardous substances in the air, water, soil, and food. We're also talking about any natural disasters that happen and how those impact your health and survivability. We're also talking about climate change, occupational hazards, so depending on your job, which kinds of environments you're exposed to. You might be working with hazardous chemicals or the like. And also the built environment, so how the materials in your space are impacting your health, how the air in your space is impacting your health. And LEED addresses all of these items, and Eric and Melissa are going to talk about a few examples of these in a short while. But the way that we've really started to think about health is how LEED addresses both local scale health factors and also global scale health factors. So let's talk a little bit about some of the local scale health factors. So these are health factors that really influence the occupants in the building that you're working on when you're working on a LEED project. So in that building itself, you're able to affect the air quality in that building and what those occupants are exposed to. You're able to affect the water quality in that building and what those occupants are exposed to. You're also able to influence the food that is served in that building. In your building, you're also able to control for certain occupational hazards and how people are exposed to different things, whether the equipment that they're working with is safe. And you're able to heavily influence the built environment, all of the materials in their space that they're working with. So when you're doing a LEED project and you're implementing the various IEQ credits in your project, you're able to have a direct impact on all of the occupants in your building and how that building is affecting their health. But in doing a LEED project, you're also able to affect the health of others globally. When you do a LEED project, you are creating a socially responsible building. For example, when you're reducing your carbon emissions, when you're improving your energy efficiency, you're polluting the outside air less, which helps everyone in the world. Similarly, you're reducing your own effects on climate change. When you have a socially responsible building, when you have a sustainable building, and it has less of an impact on climate change, you're helping to reverse the impact of climate change. It helps everyone in the world. So by doing a LEED project, you're able to affect the health of the occupants in your building, but you're also able to affect the health of everyone in the world. So LEED affects both local and global health. And now I'm going to hand it over to my colleague, Melissa Baker, who's going to talk about some of the LEED system goals and how they tie in with health.
Thanks, Megan, and good afternoon, everybody. I'm Melissa Baker. I work on our technical core of the organization, so we talk about end-to-end product development and delivery, from developing the LEED rating system, helping people use it, figuring out how to make it work in different space types, and also our education team, so helping to educate people on all these awesome topics that we get to talk about every day. I'm excited to be in this session because actually health and how the built environment can affect health is the reason that I wanted to work at USGBC in the first place. So I started out working in energy efficiency and environmental science, but I was very interested in how we could help people and help affect health directly, especially for children. You know, Megan made a point about the children's health statistics, but certainly, you know, for all of us that are occupants of buildings. And, you know, we work at all scales, from residential to commercial, to healthcare, to places where there's not actually even that many people, data centers, but as Megan made the point, all those buildings do impact the global health. So I'm going to take it from the global conversation to a little bit more how we work within the rating system around health, and then Eric will talk more directly about some of the credits and the credit outcomes for health. And certainly, I think we want to be able to help answer questions about how to best implement those credits. Hopefully, you all are aware we have a USGBC track, and so we're sort of looking at different slices of the rating system, and as we focused on health, we said, okay, let's really look at that indoor environmental quality aspect. So we'll talk a little bit more about that today. Within LEED, you know, we have a set of LEED system goals. So when you're pursuing a certification or you're in a LEED certified space and you're sort of thinking, well, how do I know what that building was designed to do, or how do I know that I'm going to get that outcome that we're searching for? We've answered that, at least in part, by setting goals for LEED and then assigning credits and weighting those and assigning them points based on the goals that we've set for the rating system. So we've tried to incentivize making choices that will get you closer to hitting on these goals, and also sort of set it up so that it's happening almost behind the scenes, that as you're sort of choosing those different credits, you're getting to some of these outcomes. And certainly, you know, number one being reduce the contribution to global climate change. That hits on many levels, of course, health, as Megan was just describing. But number two, enhancing individual human health. And really, I think that means looking at how people interact with their environment, both actively and passively, and designing a building to enhance activity within it or on the exterior, help people make healthy choices, take the stairs, but also, choosing the right materials or designing the ventilation system so that you have good indoor environmental quality. So to talk a little bit about sort of where that shows up in the rating system, I know this is tiny, but we just tried to sort of map some of the credits in the different categories that touch on health. And I will say this is just the start of this effort for us. This is sort of my mapping, but we have some great public health folks who are helping us to really map and produce for you a little bit more of that cheat sheet of, okay, if you want to affect health in this way, choose this credit or choose this credit compliance path. And we're certainly learning that there are some that have very direct outcomes, so this directly affects health, and there's some where if you apply it in this way or you do it in conjunction with something else, then you have more of a health outcome. So I think that's a good learning experience for us, and we want to be able to get that information to you all so you can make informed decisions on what you're doing with the rating system. And just to give a few examples, it sort of ranges from bigger choices of having maybe open space set aside on your site so that people can be outside in nature. When we were working on LEED for Healthcare, we really wanted to make it a priority for people to have places of respite, but not just for patients, which is of course important to healing, but also for staff who have very stressful jobs. It's good for them to get outside. The research has shown that that really helps people to decompress and then come back and do a good job. So we added some of those credits in. Always looking at interior space, whether it's thermal comfort or lighting, trying to disclose information around what's in the materials and start to make choices there. Trying, again, to sort of hit across the board. On the EQ side, or indoor environmental quality, looking both on, operations is up here as well, so things like green cleaning or integrated pest management that can really make a big difference around how people are exposed, in the building to different chemicals, but also not having smoking, for example, or giving people the ability to adjust the temperature within their space, adjust their lighting. I think we are learning a lot more about lighting and how that affects performance and what makes people comfortable. Certainly the circadian sort of rhythms mapping and how the light can change to help. There's some really great both, existing research and also some interesting studies that we know, folks like the General Services Administration of the U.S. government, I know they were talking here this week. They've been doing a lot of studies on their occupants, actually, and starting to see what works better for people. There were some studies out of Harvard announced a couple years ago about productivity and how that's linked to the quality of your air. And primarily, if you have fresh air and, you're able to perform better and be a little bit more alert, especially after lunch like we are right now. So trying to take that research, show through the intents in the credits what we're aiming for, and helping you understand that information and make informed decisions through the credits. So that's really, we're trying to take that higher level thinking and make it very actionable. The pilot credits I wanted to mention just because I think this is an interesting place where we kind of get to test out some ideas. Hopefully folks are aware we have a pilot credit library. You all can bring forward pilot credit ideas. You can test pilot credits through your own projects. We have a few that are definitely directly related. The design for active occupants is one that has been worked on for many years and is out there now for use. I wanted to mention, of course, social equity, because that certainly has strong ties to health and community health. A few other places, like we're trying to kind of refine our methodology around things like daylighting and learning controls for thermal comfort. So how does the building react or interact? I don't know if anyone was at the lunch yesterday. We were sort of talking about that fourth industrial revolution, and at least for some of the panelists, the daydream was that your space would automatically react to your both verbal and maybe nonverbal cues, or maybe your body temperature or level of activity. So it was interesting to sort of think about how much you want the space to react to you and to be able to sort of have it that, mind of its own versus having control. I know that's hotly debated, so always interesting to talk about. So just to give you kind of a snapshot on where we're sort of testing some new ideas and what thinking has come forward. But certainly, we're going to have some time for Q&A. I'd love to hear from all of you where you see health being affected and what you might want to test out in a pilot credit. And hopefully, or not hopefully, by next year, we'll be back. We can talk more about the mapping we've done and those health outcomes. And then I did not want to forget our residential friends. We've tried very specifically to focus in some key areas in residential, combustion primarily in the kitchen, how to have great indoor environmental quality and enough air moving through. Some things like garage pollutant controls and other ways of looking at thermal comfort within the residential space. So definitely not forgetting our residential projects. So now I'm going to turn it over to Eric and let him get us to that next level of detail.
Okay, thank you, Megan, and thank you, Melissa. My name is Eric Ring. I'm a mechanical engineer by training. I'm not with USGBC or GBCI. I'm with an integrated architecture and engineering firm out of Southern California called LPA, and I'm here representing both the practitioner side, because I work on a lot of LEED buildings and I design a lot of LEED buildings, as well as I'm the current chair of the Indoor Environmental Quality Technical Advisory Group for USGBC. So that's a volunteer committee that helps USGBC weigh in on various sort of technical issues associated with specifically the Indoor Environmental Quality section. Some of you may have come here hoping to see Brendan Owens. I'm his substitute. I apologize for that if you're sorely disappointed, but I will try to do my best. The Indoor Environmental Quality section of LEED is sometimes, I think, thought of as kind of a mixed bag of pretty disparate topics and different calculations and different reference standards. And while all of that is true, I think, structurally, the Indoor Environmental Quality section really addresses two primary topics in buildings. The first one is really reducing exposure for occupants to indoor pollutants. So that covers things like smoking, ventilation rates, low-emitting materials, doing assessment and managing indoor air quality, as well as things like green cleaning and pest management. So that's kind of protecting folks from the stuff that they probably shouldn't be ingesting into their system. The second big area is really enhancing the indoor environment. That covers issues like daylight, lighting quality, quality views, thermal comfort, and acoustics. And so really, the IEQ section, these are a lot of very different sort of topics, but they all fundamentally fall into those two buckets. Another real challenge that I think all practitioners struggle with is all of these topics are frankly difficult to quantify. These are qualitative aspects of the built environment. It's right there in the title, Indoor Environmental Quality. LEED, of course, is a rating system, though, and it's a rating system that's based on points. So LEED over the years has evolved and developed to try to quantify and assign credit to things that are fundamentally qualitative aspects of our environment. And LEED v4 was a big step forward in trying to refine and enhance a lot of the ways that LEED quantifies what's otherwise qualitative. This is from the LEED reference guide that good IEQ is supposed to protect health and comfort, enhance productivity, decrease absenteeism, improve buildings' values, and reduce liability. That is a very tall order, right? That's a lot to ask a building to do. That's a lot to ask a rating system to do. But that is the aspirational goal of LEED and of the Indoor Environmental Quality section of LEED. So I'm going to talk specifically, obviously, again, these are a lot of topics. Each one of them you can write textbooks on. We have an hour here together today. I'm going to talk specifically about three credits or areas within LEED v4 and how they've developed and how those are sometimes applied to real projects. The first one has to do with minimum indoor air quality performance, which has been a LEED requirement, a LEED prerequisite, really since the beginning of the system. LEED v4 introduced or amended this requirement to include outdoor air monitoring as part of the prerequisite. Anyone who's worked in LEED for a while will know that in version 2009, that was a credit. In version 4, it's actually part of the prerequisite, and that sets up some technical challenges that I'll talk about in a minute. Additionally, there's a credit for enhanced indoor air quality performance. All of this is linked to ASHRAE standard 62.1, which is the common ventilation standard in our industry, and specifically the ventilation rate procedure. There's also a pilot working group that's working on allowing teams to to qualify for the prerequisite and the credit using the indoor air quality approach. The ventilation rate procedure is really an engineering calculation, designing the right amount of CFM for a given space of outdoor air. The indoor air quality approach really looks at the specific pollutants that are being experienced in a space at any given time. It's a lot more technical and frankly more technically challenging, but if anyone's interested in that, there's a session tomorrow, I think at 8 a.m., of some of the working group that's working on that specifically. One thing to note about the ASHRAE 62.1 standard is it's again right there in the title. It's ventilation for acceptable indoor air quality. And to steal a joke from William McDonough, if I asked you how's your marriage and you said, well, it's acceptable, that might not be the greatest endorsement for indoor air quality. The research that really underpins ASHRAE 62.1 was about essentially, do people who enter a space notice kind of the odors and stuffiness? Is it unacceptable to them or not? And that's really linking back to decades worth of ASHRAE research. What drives the ventilation rates in ASHRAE 62.1. There's some really interesting research, and yeah, this slide's difficult to read, that's come out in the last few years, starting at Lawrence Berkeley National Labs and Chamber Studies, and then this study, which was sponsored by United Technologies Corp. And performed by researchers from the Harvard School of Public Health and some folks from the medical school at the State University of New York. They looked at actual building occupants. They put them in different ventilation conditions, and then at the end of the day, after they'd worked all day in that condition, they had them take a standardized 90-minute test of cognitive function. And both in the chamber studies and in this field study, there were some pretty remarkable results that essentially at 3 different conditions, 500 parts per million, which is kind of a very well-ventilated, almost ambient conditions, 1,000 parts per million, which is maybe more typical, and then 1,500 parts per million, which is an elevated CO2 level, but frankly not uncommon in the real built environment. The graphs up in the image there are 9 different cognitive function tests, and pretty much across all of them, cognitive function was reduced at the elevated CO2 levels. The point being, ventilation isn't just about acceptability and comfort, it's actually affecting our cognitive function, and there's a lot of evidence that's starting to point that way. I'll note the room we're in right now, we're at about 625 parts per million, according to my little meter, and we do have CO2 meters in the back that should be controlling the ventilation rate in this room, so hopefully our cognitive function is really solid. We're not up at the 1,500 parts per million. But this has real implications for when we think about designing schools, when we think about designing office spaces, and I'll note in the very lower right hand, that last category, again, it's hard to read, is strategy, and it actually showed the highest diminishment of cognitive function was for the area of strategy, which a lot of corporate strategic decisions are made in crowded conference rooms full of a lot of CO2 and probably underventilated. And maybe as an industry, we want to be rethinking how we make strategic decisions and doing that in outdoors or in a better ventilated environment. I'll note, from a project example, this is a project my firm is working on. It's currently under construction. It's a LEED V4 project. It's for the city of West Hollywood in Southern California. It's an aquatics and recreation center that this image is from an existing city park. The project links to the city park. It's a very complex program built on top of an existing parking structure with a combination of community rooms, fitness rooms, sort of multi-purpose facilities, as well as a large recreational gymnasium for the community. And then there's actually a swimming pool deck on top of the entire structure. So there's a lot of different uses. It's very complex. And from a ventilation rate calculation standpoint, it was a challenging project. One thing that we find our colleagues at GBCI do that, frankly, the authorities having jurisdiction we go through is they really scrutinize our ventilation calculations. They're questioning, why is this classified as a classroom instead of a multi-purpose space, instead of a conference room? They're looking at our calculations very carefully, and in a project like this, and in frankly a lot of our projects, there are a lot of sort of subjective decisions we make as engineers and as designers about how to apply ASHRAE 62.1 to a real project. We're now through the design review in V4 on this project, and we were able to ultimately achieve the prerequisite as well as the enhanced credit, but not without quite a bit of back and forth and dialogue with GBCI. Additionally, I mentioned that the monitoring requirement for outdoor air was moved into the prerequisite in V4. So this project is largely served by two custom large VAV air handling units, one for the gymnasium and one for kind of the balance of the space. Integrating an outdoor air monitoring device into a large custom piece of HVAC equipment is not really a big deal. That's just a specification. But there's some kind of ancillary HVAC systems. There's a parking office down on the lower level. There's a small lifeguard, basically, office up on the pool deck that have little sort of 200 CFM fan coil units serving them. And introducing an outdoor air monitoring device into such a small piece of equipment, it's not a standard option. It's not a custom piece of equipment. That's technically a difficult thing to do. This is one of the issues that's come before the tag, not specifically with this project, but from other projects. And there is a LEED interpretation, which was just issued in July, which essentially exempts small systems from that prerequisite requirement for outdoor air monitoring, recognizing that in the industry that it's difficult at that small level to really do what the prerequisite is asking for. And so this is an example of where LEED is evolving, and as more LEED V4 projects are out there in the marketplace, the technical committees within USGBC and GBCI are responding and adapting and trying to make sure that LEED makes sense in the marketplace. The next area I wanted to touch on, which was also sort of substantially revamped in LEED V4, what has to do with low-emitting materials. I think looking back on, now almost 20 years of LEED, low VOC products is one of the true success stories of the green building movement. When we started doing LEED projects in the kind of late 90s, nobody knew what this was. Most manufacturers weren't publishing VOCs on their MSDS. Getting formaldehyde-free binders in composite wood was nearly impossible. Fast forward to 2017, it's very common in our industry. Manufacturers have stepped up and refined their products and published data. Formaldehyde-free binders is essentially regulated now by the federal EPA. 60 Minutes does exposés on companies that don't comply with that. So the world has changed a lot, and for the better around this topic area. And LEED V4 responded as well. In earlier versions of LEED, this was a fairly blunt instrument looking at 4 specific products and setting VOC limits. And so there were 4 points for 4 different credits. That's now combined into a single credit that's up to only 3 points and looks at more topics and deals with more things. The reference standards have been updated and really expanded, especially to deal with some of the international standards. There's a general emissions evaluation now required, which is based on the California Department of Health standards, and that requires manufacturers to go out and not just declare that their product has so many grams per liter of VOCs, but what's the actual emission decay profile of that product in a chamber testing. Because a product might be low in VOCs, but if it continues to emit VOCs for a long period of time, that's actually probably worse for the building occupants than a different product that might be higher in VOCs, but that decays very, very rapidly and therefore is easier to get rid of. There's also a recognition of inherently non-emitting materials that primarily deals with flooring, things like stone and untreated lumber, which simply have no emissions profile. In the past, frankly, project teams have struggled with that. How do I do emissions testing on a stone flooring? This is all custom stuff. It's not something that I'm going to pay to have an emissions test on, but there's no VOCs in that. So again, this is where LEED is both, LEED V4, I should say, is both getting more stringent, but also trying to work with the realities of what happens in the marketplace. And also, there are new products introduced into the low-emitting materials section, including insulation, furniture, and for healthcare and schools projects specifically, actually exterior products. So taking the VOC emissions issues beyond just the interior of the building to deal with the fact that if you're using certain asphalt sealants and things like that on the exterior of a project, that could have health impacts as well. So while our industry has gotten, I think, very comfortable with low VOC and low emitting products, I think it's worth noting that for LEED V4 projects, there's going to be some retooling and some sort of re-education of subcontractors and others who might be used to complying in a certain way and now need to kind of adjust some of their expectations for what they're getting from manufacturers and how they're putting together the calculations for this credit. The third area I wanted to talk about is daylight, which we're sorely lacking in this room. You know, it's very standard at Greenbuild and other conferences. We talk about daylighting in windowless rooms. Daylight is, of course, a topic that is highly qualitative. It's nuanced. It's very dependent on climate, on context, on the building form, on the uses within the building. It's probably one of the areas in LEED that's the most difficult thing to quantify and say this set of metrics is good daylighting and this other set of metrics is not. But fortunately, our friends at IES, the Illuminating Engineering Society, recognized that, frankly, in the past, the way LEED credited projects for good daylighting was pretty rudimentary, quite frankly. It was a pretty, again, blunt instrument. So there's a daylight metrics committee within IES of experts in the field who took it upon themselves to really think through and start developing what are the right metrics that systems like LEED can use to credit well daylit spaces. And they came up with two metrics that now form the underpinning of the LEED daylight credit in LEED v4. The first one is spatial daylight autonomy, or SDA, which is the idea that a space, how much of the time, how much of a space can operate without any electric illumination, with purely daylight. So that's expressed as a percentage. And then the other one is annual sunlight exposure, ASE, which is really a metric of glare and of direct daylight. So a well-daylit space should have high SDA, meaning there's a lot of abundant daylight, but reasonable or low ASE, so there's not too much direct harsh daylight. And these are some diagrams, and Kevin, and I'm not going to be able to pronounce his last name correctly, but Kevin van Wijnlingberg, who's a professor at the University of Oregon, has been really instrumental in leading this committee and bringing that research to LEED. But interestingly, that same committee has essentially already come back to LEED and said, you know, I'm not sure we set the thresholds in the right place. And again, this has come before the technical advisory group. Primarily what they found is in practice, designing spaces with high SDA but low ASE is obviously challenging. The more windows and daylight and monitors you provide, the more direct exposure there's going to be. And so again, there's been a LEED interpretation that raised the threshold from specifically for ASE from 10%, which was originally published in LEED v4, to 20%, essentially doubling it and crediting projects that are able to achieve 10% with an exemplary performance credit. So that's sort of worth knowing and worth understanding. Additionally, as I think Melissa indicated, again, there's a lot of really great research of how important daylight is to our health and wellness. This is just one study which was performed by researchers at the University of Chicago and at Loyola in Chicago. It was a combination of architects and public health professionals. They looked at office workers, a group of office workers, about 40 total people, half of which were in well-daylit space and had exposure to daylight throughout their day, and half of which did not. And they found consistently across a number of metrics, general activity, length of sleep, quality of sleep, any number of wellness metrics that these public health academics could measure that, as would be expected, folks who work in environments where they have no exposure to daylight performed worse than those who are in daylit environments. There's a lot of research going on about circadian health and things like shift workers who are all night long exposed to sort of high levels of light in a hospital setting, for example. And there's just increasing, it's sort of common sense, but there's increasing public health and academic research to demonstrate the importance of us all being exposed to appropriate levels of daylight throughout the day, which again, unfortunately, we're not here in this room. This is my own firm's office in San Diego, California. It's a really terrifically well daylit space. It's an old kind of industrial facility with this sawtooth roof and these big high north-facing light monitors. This was a LEED CI space under version 2009, and we quite easily passed the daylight credit under the old version of LEED. It's a really very well daylit space. This is, of course, the architectural photograph that's all polished and clean. Functionally, as you might expect, it gets a little glary sometimes. We've had to add some interior window coverings that we weren't expecting and that frankly we didn't want to pay for, and we don't think they look very good. But it can be, for certain people in certain areas of the office, it can be hard to work. It's simply too bright at certain times of the day depending on the sun angles. And additionally, some of those folks you kind of see there have had to build the little glare screens and things like that because there's, again, certain times of the day and times of the year when there's just too much daylight and it's too hard to control and it's difficult to work. This is what LEED v4 was largely trying to deal with this balance between spatial daylight autonomy, which we do great in this office on, versus the annual sunlight exposure, really the metric of direct glare, which we struggle with in this office. So the current office that we're working on is our office in San Antonio, Texas. This is kind of a grimy old industrial building. It's an old vending machine distribution warehouse. And you can see there is, again, a pretty nice light monitor that brings a lot of daylight into the space. You know, and this is a LEED v4 project, and certainly one of the questions we had as a design firm was, well, what's the right balance of light? And it's a little dark and glary now, but when we clean up the finishes, and we brighten it up, is it going to be a well daylit space? Should we be introducing additional skylights or light monitors? And so, you know, our design studies looked something like this. This is kind of the rendering on the bottom, and a study, sort of hand sketches to a simple kind of Google SketchUp to Safari model. What we found was certainly that we didn't really need to or spend money on additional daylighting, that the daylight profile in this building was pretty good, at least in the computer model. There's certain areas that are certainly much darker, and that drove our design programmatically to think about putting restrooms and storage rooms and electrical rooms and things like that in those areas of the building that don't get as much daylight, so that they would be, so that we could appropriately balance things. But I'll be honest here, we haven't yet. My lighting design team is busy for, paying clients, we haven't been able to yet put this through the sort of fairly intensive daylight simulations to really fully calculate out the SDA and the ASE. And I have an open question in my mind. I'm not sure that we'll get there. Those are challenging calculations. Again, they're new to LEED v4, and they take a fair amount of effort. And frankly, analysts and users who really know what they're doing with those calculations, but should, when it's done right, drive a much better daylighting design. So to conclude, and then we'll take some questions, certainly, we're talking about LEED credit strategies for healthy spaces. A lot of this is sort of old advice that I'm sure you've heard before, but certainly starting early, LEED v4 is new, and a lot of folks who are used to earlier versions of LEED have a learning curve and need to be addressing some of these LEED topics probably earlier than they might have on their last LEED version 2009 projects. The addenda and the LEED interpretations are continually evolving and updating, and it's worth reviewing that and understanding that, because there are specific examples where there's been adjustments to LEED credit thresholds via both addenda and interpretations. I would certainly encourage you to document your assumptions, and I know GBCI, they can only deal with the information that LEED teams provide. So again, with things like ventilation, documenting what we assume the spaces to be and how we made those assumptions goes a long way. I would say providing that in clear, concise narratives. GBCI generally doesn't want to see your entire spec book or your entire set of drawings, and they won't have the time or the wherewithal to go through all that, but a simple, one-page, two-page narrative that describes exactly what you did and why you did it goes an awful long way. And I'd also encourage you to recognize the limitations. Again, LEED is a point system. LEED v4 has made real strides and improvements forward, but it's not perfect. It's got limitations. The design and analysis software that we all use has limitations and can only analyze so much. And I would encourage you to not let that get in the way of creating great healthy spaces. The image on the right here is a community college building my firm designed in Newport Beach, California, and this is this sort of tremendous day-lit, indoor-outdoor, naturally ventilated sort of gathering space that's really successful. It's very comfortable. It's used and loved by the community. This project was pursuing LEED certification, but ultimately sort of contractual issues between the contractor and the client prevented it from ever getting LEED certified at all. It's been occupied for 5 or 6 years. It's a project I'm tremendously proud of, and it's a really great, healthy space. Unfortunately, it's not a LEED space, but Again, that's, our achievement with LEED is great and should be celebrated, and that's what we're all, a lot of us here at Greenbuild to do, but I don't ever want that to get in the way of doing the right thing and creating healthy spaces for all the reasons we've talked about here today. So with that, I think we will take questions. You have plenty of time. Yeah, please, you guys have all seen the drills. Please step to the microphone. Yeah.
Hello, my name is Susan, and I am very encouraged by the discussion on human health. Two documentaries, Cowspiracy and What the Health, have recently started some conversations, and I'm wondering, are we as an organization getting closer to talking about animal agriculture as it affects human health and the environment? Thank you.
Are you asking about farming or like food production?
Yeah, like animal agriculture and methane gas, which is off, and how it affects, our environment in general, and then also the health effects that eating animal-based diet, Western-based diet, affects on the human health also.
Gotcha. So just so everyone heard, the question was, I think about the like off-gassing from food production, as well as then the health effects of a Western-based diet. I mean, I know, right? That's Megan just said. I think we have a new pilot credit on our hands, right? That's it. All good questions. Certainly, where we've gone on the food side is a little bit more about like localized food production and trying to encourage sort of thoughtfulness around where food comes from and what can be done in a community. We haven't necessarily touched on some of the issues you've just raised, but certainly, it has a lot of potential for a pilot credit and further exploration. So, yeah, thank you. Other questions, comments? Love to hear it if you're focusing on health in your projects as well and what you've seen as outcomes from that. Please.
My name is Maria Prawirodiharjo, and then my question is in terms of the fresh air. There is a movement in my organization that we are going to install the operable window, but also from a mechanical engineer side, and they are complaining is how they balance the air.
That's right up my alley. So the question was about integrating operable windows into otherwise conventionally air-conditioned spaces and how that deals with air balance, which it is, thank you for asking the question. That's been something I've focused on for a long time in my career. I guess I would say these are just technical challenges, and a lot of it is a mindset shift. There's no reason why, there's no real reason why you can't have operable windows in a facility that's otherwise air conditioned. People might not be used to it. In my firm, we've certainly integrated magnetic contacts in the windows to let the control system know the windows are open, and then have the control system respond by either setting back thermostat set points or setting down or shutting the system off altogether if that's appropriate. Certainly the sort of building pressurization issues can be tricky, but frankly, most buildings aren't that tightly controlled anyways. One analogy that I often like to use when this issue comes up with clients is certainly most of us, if we're buying an automobile, we don't make a choice between either operable windows or air conditioning. And in most parts of our country, although not all, if we're renting an apartment or buying a house, we get both operable windows and heating and cooling systems. And as users, we're perfectly comfortable in those environments making the choice and making the decision and saying, today I want to have the windows open and the air conditioning off, and tomorrow I want to seal up my house and run the heater. We do the same thing in our car. Somehow once we get to commercial buildings, that becomes technically impossible. I guess I don't ascribe to that, and I would encourage you to push your design teams and your engineers and to look for the progressive design teams and engineers who are willing to embrace kind of new ways of working.
Sure. Biophilia is certainly something that has been studied a lot, and specifically in recent years, and can have huge effects on stress levels of the occupants in the building, productivity levels, and just that connection to nature. And well, Melissa might know a little bit more about this, but our technical committees have been working on a pilot credit for LEED related to biophilia. I don't know if you know the status of this one. Yeah, okay. Keep an eye out for it. It's coming soon.
We'll definitely, we can look into it for you if you want a precise timeline, but we definitely have had those conversations about how biophilia can be used, especially in places where, maybe daylight is not appropriate, or you just can't have daylight, but there's other ways to sort of bring in that connection to the natural world, or views for that matter, right? So, absolutely important. Good question. Anyone else have any other innovations or other things like biophilia that you're using or focusing on health? And how's that working for your projects? Please.
I just want to say I'm happy to see that outdoor air thing moved to prerequisites, because it's been so often like discussing points and energy and not really focusing on the benefits of it and the impact. And that whole study with having the function was like, so I'm so glad that happened.
Great. Yeah, the comment was she's happy that we have a prerequisite for certain amounts of outdoor air and ventilation coming into the rating system. So, yes, that's great. And it is, we know it can be trade-offs, right, between energy efficiency and amount of ventilation, but certainly important, as the research has shown, for human health. So I'm sure folks, I don't know if you have any comments on that, Eric, it's something that has come up a lot from sort of how to optimize your systems and what choices to make to, again, get enough air, but also hit that energy efficiency mark. Not to put you on the spot.
No, it's a great point, and that is part of what's really interesting about some of the research that's emerging, is that sort of tension between energy efficiency, and it's obviously climate dependent, but bringing in more outside air typically comes with an energy penalty, but there's such an important benefit of maintaining good air quality to all of our health and functioning that it's a trade-off that has to be evaluated at every project, but I think increasingly the recognition of how important good ventilation rates are to indoor air quality is really critical. I'll note along those lines, something that the technical advisory group has certainly been dealing with is, which is maybe related, is that everything we've just said is largely U.S. focused and U.S. based. And in the vast majority of our projects and our environments, bringing in more outdoor air improves the indoor air quality. When you shift to projects in like Shanghai and some of the real urban centers outside of the United States, the equation kind of reverses, that the outdoor air quality in certain areas is so poor that increasing the ventilation rates actually makes the indoor air quality potentially worse, which is a really sort of difficult technical challenge that those projects are dealing with. So I'll just note that in most cases, most of the time, lots more ventilation is probably a good thing for your health and welfare, but there are certainly environments where that's not true.
Hi, my name's Katie, and so I have a question because I have someone literally working on their master program in terms of how many air exchanges there need to be per hour in an operating room. So then I started thinking, okay, in hospitals where you're trying to control germs so much, and you don't want to bring in too much outside air because of the germs that come in, how does all that play together with design?
Sure. So the question was about operating room and medical ventilation. And where are you located? In Nashville, Tennessee. I can speak to California. Typically in medical and in terms of infection control, there is an emphasis on very, very high ventilation rates, oftentimes 100% outside air, and certain numbers typically in most of the medical codes are written around air changes per hour, which is of course different than the metrics that ASHRAE 62.1 uses. But that the sort of the medical community has recognized for a long time that if you want to kind of control pollutants in the indoor environment, high levels of ventilation are the best way to do that. There's definitely, honestly, some like Kaiser Permanente is looking very hard at questioning some of those assumptions, because there's frankly probably a lot of hospitals that are almost over-ventilated, and the energy penalty associated with that in a 24-hour-a-day facility is really extreme. But I do think that ultimately the starting to not just work on these sort of fixed defined ventilation rates and actually trying to do a better job of really monitoring the air quality in buildings is where the overall building industry is headed, and certainly the medical community as well.
I can't speak to Google specifically, but there are a few materials databases that we're starting to work with to make it easier to identify which materials are considered healthy materials for your building and which products are made with healthy materials. So we're starting to make some movements in that space and starting to build these databases to make that information more transparent and also easier for you to document these materials credits in your projects. So we're slowly getting there, and we hope to be able to make more progress soon.
Well, thank you. We are right at 2 o'clock, so thank you, everyone. This is a great session. Glad to get to talk to you.